You're watching the Randy Alvarez Marketing Report video blog. I'm Randy Alvarez. Today's topic, the Global Implantology Summit. It's coming up. It's in Los Angeles, 2018. With us, we have one of the founders, Dr. Kianor, Shah. Dr. Shah, welcome to the program.
Hey, thank you for having me, Randy.
All right, a lot to talk about. We have a short period of time. But you put together, I guess it's the first of its kind.
Correct.
You have like 50 speakers or something like that?
From all over the world. We went and looked for experts in their particular field, and we had to search all over the world, and we were surprised that we actually were able to secure some of them.
Yeah, because you've got some pretty big names.
Some of them are
big names, actually.
Booked out for speaking arrangements for 2 years.
Now, you said when you put this together, you told your partners, let's do something that's never been done before. Elaborate on that.
Correct. I was in the shoe of the individual that wants to enter the implant industry. I was curious. I wanted to find out what it's all about. So a weekend course led to over a decade of searching and looking and learning about implantology. What I realized is there's not a particular program that permits you to learn everything from the soup and nuts, and hence the idea came about to go out and seek the best of the best to come together under one roof to be able to allow or afford the opportunity to our colleagues that want to enter this market to have the toolbox that they need.
Okay. So they could pick the surgical track or the restorative track. Is that right?
Yeah, absolutely. As you know, some of the doctors that don't have the particular surgical experience, so the opportunity for them to go through the restorative track is able there for them for 3 days. But there's also a surgical track for those that are interested in the surgical aspects of treatment in implantology.
Okay, so for the beginner, you'll have plenty of courses for those beginners.
Absolutely.
Is that right?
Absolutely. We start with the simplest of anatomy and carry it all the way through complex implantology and every topic in between. Now, that doesn't mean that it's all implants. We're going to be talking medical emergencies, pharmacology, radiology, endodontics, periodontics.
Stem cells, things like that?
Stem cells, the new innovations that are currently in the market. So where have we been in implantology? It starts with our keynote speakers in the history of the time, such as Mr. Ryan or Dr. Niznik, who've been there from sort of the beginning. Once we understand the history, we can look forward to what the future has to come for our industry.
So more and more dentists are breaking into implant dentistry, right? It seems to be the newest, hottest trend in dentistry. I mean, dentistry has been patchwork. I've only been working around dentists for about 20 years, right? And it seems like you guys were doing a lot of patchwork in the old days, where now you get your teeth back with dental implants. But so many dentists are resistant or afraid of legal issues, or they don't feel like they have enough training. What's the hesitation? And what will this course do for those people that are a little bit afraid to get started?
Randy, there are over 500 million teeth missing here in the United States, and I don't want to go into the numbers around the world because it might scare you.
Okay, I'll be scared.
There's not enough clinicians, specialists that can care for these patients. In order to solve this silent epidemic, we need the help of all dentists and various disciplines as well. So coming in and only placing 1 to 2 million implants for 500 million missing teeth is simply not enough. We have failed the general public.
You call it an epidemic?
A silent epidemic. A big problem we have. 40 million Americans in upper lower dentures, 120 million Americans missing at least one tooth. There's a big problem. And the solution is not to create barriers for education, but to encourage all of our colleagues to participate in becoming part of the solution.
Okay. So you're a group of people. So tell us a little bit about the speaker lineup. I mean, you have 16 speakers today, a day, one keynote. Tell me about that.
So in order to be able to run through 50 topics by the experts and have them have enough time to reveal their message to the audience, a 15-minute scenario would not be okay. So each speaker has 45 minutes to an hour, including the introduction that we will be making for that speaker and about their topic and what the course objectives are. 16 speakers, 8 out of the restorative track, 8 out of the surgical track, plus a combination of both tracks for the keynote speech every day of those 3 days. That's 3 days of 17 speakers, and that will bring you to that number of 51. I'm going to be the host. I will not be particularly speaking on a topic, but these mentors of mine for many decades are going to help the audience get a bit of a more perspective of why there's such a, for lack of better terms, gold rush in implantology.
Now, most of these, or a lot of these speakers that I see on that list, they have their own implant seminars, their own implant training programs. So my guess is they'll go to the seminar and they'll say they could go to this guy's or this guy's, like as a follow-up.
And that's part of the vision.
Yeah.
That was part of the vision. The vision was to bring together the best and the brightest, not only the institutions, but also the speakers, to create a scenario of maximum information exchange. It's prudent to understand that we are not a membership organization, which we want to hold this event once a year around the world. And as a consequence, these associations, more than 10 leading associations have joined us, see the value in coming together and putting the whole competitive thing aside to create something for a greater good. And as a consequence, the doctor that is visiting with us or coming in as an attendee will have the option to go with X, Y, and Z, depending on what topics are being presented by that group, what their expertise is, essentially creating what I'd like to call a toolbox to get started, which they won't have to do what I had to do, go from Los Angeles to Chicago to New York to Florida for a good 10 years to pick up on every one of these topics. They'll have the very expert in that topic at that location.
You said you went to CE for 10 years, every implant course you could find, and they didn't have it all together, or all the topics together, from A to Z, the way this one does. You believe that?
I very strongly believe that because I experienced it. Yes, it's very true.
All right.
It was a progressive scenario for me to go from dental school to all the way sitting at this table with you a few months ago discussing full mouth rehabilitations. It was a very long process, which can be very, very shortened if you know where to go. I didn't know where to go. One thing about marketing is one thing, but the actual effect that you get as an experience from attending a course is a whole different story. But if you have interaction with your colleagues and Dr. Jones says, hey, you know, Dr. Arun's course is wonderful, or Dr. Picos's course is wonderful, or Dr. Kim's international organization is wonderful, you will have the choice to make as to whom you want to go with, or if you want to go to all of them. But at least you get to meet these people, get your toolbox, and get an hour worth of a preview, a glimpse of what your career could be like. I work 3 days a week now.
Okay.
And I attend to a lot of people doing implantology, which I built a career around this very surgical skills. It helps patients. It helps me pay the bills, the student loans.
Is it the happiest group of patients, implant patients?
When the procedure is done. When the procedure is done, you're going to make a friend for a lifetime, especially if you're doing larger cases. Once you start with the single implant, the single tooth-borne implant crown, you start there, you do the simple cases, and you progress, and you start liking it, and you start understanding the biophysics around implants and how it works, and what you need to do to be successful. And one thing, and you're going to make some you're going to have some failures along the way, and that's part of the process. But in 5 to 10 years out of school, you could be placing a lot of implants, helping a lot of people, and I believe that placing the actual implant is easier than doing a filling. Because when you do the extractions, which you all pretty much know how to do, a simple extraction and a central or a premolar, and there's a root guide for you to put the implant in, I could never understand why a dentist would be apprehensive to put that implant into that socket, which is away from anatomical structures. It's guided, it's a natural position. It's the simplest form of starting with an implant. That's how we started with root canals. They told us to go to the front tooth, and then go to the next tooth, and then go to the next tooth, and then it progressed into something where we could do root canals comfortably and competently.
So do you look at this as like, especially, and we're talking about the new people right now, that this will give them the leverage that they need maybe to take action with some of their goals? Because a lot of them are in a holding pattern of learning more, etc.
Or have the apprehension. And the answer to that is yes, because I went to, I remember it was a weekend course by Camblog in Chicago. And they came to my office and they said, hey, this is a nice course. You want to go talk to them? You want to take a look? They didn't charge us for the attendance at that time. It was a very short scenario. And from that arose this career I've built over the last 12 years.
You're helping people all the time. We were talking in the green room. You had a guy that came in, no teeth on the upper on Monday, and on Wednesday now he's got a fixed set of teeth.
Yes.
Is that right? That's in your practice in Palm Desert.
That happened because it was a precision attachment case that we didn't have to particularly do guided surgery. I flapped everything, I was able to see everything, and the patient had limited financials. As we discussed in a previous show, we try not to deny any patient. There's always options for the snap-on options or the fixed option. In this particular case, we were going with the snap-on option. Yes, the patient walked in, we spent some time, showed him the CTs, made the measurements, made the looks, and as apprehensive as that patient was, by the time we got done with the consultation and going through the steps of the process, the patient signed up and we were able to get in and do the surgery and get the immediates back from a Monday to a Wednesday, where he walked out with a brand new set of teeth, all teeth removed, and I believe, if I recall, was 8 implants replaced that we will do precision attachments for.
Okay, we're out of time. Final message to the newer implant dentist that, again, for whatever reason, is afraid, or maybe they think it's complicated, or whatever. They don't want the lawsuits, or headaches, or stress, or whatever. What do you say to them?
Get started. Get your feet wet. Get online, register for this symposium, meet the 50 people. After you walk out, you may have a moment within the conference, you may have it afterwards, but it might change your life, and rest assured it could change the life of many, many of your patients. Get it done. Come to the conference and join us.
Is that the way it happened for you? Like, was there a point where your mind shifted and you said, implant dentistry is the future? Did that happen to you? I mean, was it like one course and all of a sudden, even though you know, sometimes in life, you know, you've heard it before, you've heard about it, you've done it, and then it's like maybe you're reading a book and all of a sudden, boom, it speaks to you.
I didn't want to do MODs for the rest of my life. I didn't want to do fillings and dentures and adjustments, and I wanted to improve myself. And as you improve yourself and you get the continuing education, the markets will recognize that. They will reward you. You work less, and your impact is going to be greater. You will build and create the life you want. And that's exactly how it played out. I've jumped into it, step by step, more continuing education, tougher cases, easier life, happier patients, happier wife, happier family.
And it can be done.
It can be done.
You know, we should speak a little bit about your practice. I mean, you are a no-name in the Palm Springs, Palm Desert area, where there are dentists on every corner. And I know a lot of these guys. So how does a guy, Dr. Shah, come from nowhere and all of a sudden just talking about implants to the community, and all of a sudden you're busy and you just started your practice? So good for you. So it's possible. You could start from scratch in a way, even though you've been in business for years and years, but you're new to that practice.
To add to that message, why that happened is because I surrounded myself with people that are experienced and that know or have been in the field. My father used to always say, nothing trumps experience. No matter how wise or smart you think you are, experience at the end trumps all.
Okay.
So I came to people like you. I got onto this show, and within a few days, I had 3 patients that needed full mouth rehabilitation. One is already in surgery last week, and the other 2 we are working up. Those are fixed cases which require more time, the guide design, the laboratory communication, the communication with the anesthesiologist about the medical of the patient. That all needs to be sorted out before we can jump into the surgery that takes 4 to 5 hours. All the teeth come out, patient wakes up, brand new life, the first day of their new life. Yeah, that's what we discussed.
And they'll learn that at this meeting.
We are hoping to facilitate maximum information exchange without a particular agenda.
It's never been done like this.
In our view, we have not been able to find a conference in the medical or dental field that housed 50 speakers comprehensively covering a topic from A to Z while inviting other specialties. As you might see from our lineup, we have DMDs, MDs, PhDs, periodontists, oral surgeons, endodontists, very diverse group.
Prosthodontists?
Prosthodontists, yeah, we have 2 prosthodontists on board. So the broader the experience of these doctors, the more information you're likely going to take away from this meeting.
Okay, good. I want to thank you.
Thank you for your time.